after all is said and done? Thank you.
Hi, thanks. And Mike has said many very, very wise things right the way through this pandemic and continues to do so. The the reality is that you lay out some very tough realities that you've just laid out as part of your question. The DG has said it before. We are at the fight of our lives. We're at a moment when the virus transmission is intensifying because of because of our behaviours. It's intensifying because of variant strains, and we are continuing to track the movement of the virus, and as it finds susceptible individuals and continues to infect them. And Mike is correct in that it is like a series of forest fires where there are large numbers of susceptible people, and the virus enters that group, it spreads very quickly, and then makes those people who are vulnerable very sick, and many die. And the reasons for that are the way in which we're mixing and allowing the virus the opportunity to transmit further. The virus is not stopping in each generation with each individual. The virus is continuing to find ways to move to the next generation of infection and causing havoc as it does so. The measures that DG has outlined and that Maria emphasized are still the same measures. We can still stop this virus. We can still interrupt its transmission. We have to double down and recommit ourselves to that process. Mike is correct. The vast majority of the population of this planet still remains susceptible to infection with this virus. It's very, very difficult to come up with an actual, accurate figure for how many people have actually been infected. Many of the seroprevalence studies have occurred over the last year. Many are 6 months old at this point, so we're dealing with older data. Maria can speak to how we're trying to address that number, but Mike is correct when he says up to 3/4 of the population and potentially more are still susceptible to infection with this virus. So this fire, to use his analogy, will continue to burn. It will continue to burn until we put the fire out. We can and need to put this fire out. We need to dampen the intensity of the flames. We can only do that right now through the measures we take individually and collectively and at government level to do that. We need to use all the tools, as Maria has said many times, in that toolkit. We have the tools, we have the means to do that. The vaccine is rolling out, it will continue to roll out, and it will provide a huge opportunity to save lives, and it will ultimately provide an opportunity to dampen and shut down transmission. But that day has not come yet, and we need to buy time. We need to buy time and save lives until that happens. And if we cannot get vaccines, and the DG has spoken to this as well, we do not want to see a prospect where we see large proportions of people vaccinated in some countries and no one vaccinated in other countries. The people likely to die from this infection is not everybody in every country. It's very particular risk groups by age and by vulnerability who are likely to get very sick and likely to die. It is frontline health workers who are exposed to this virus every day. This is whom we need to protect first. It's not about the overall percentage of the population that's susceptible. It's not about the overall percentage of the population will ultimately be infected. It is, are we going to allow those people who are vulnerable and those people who are most at risk to get sick and die from this virus? That is what the DG has spoken to. The need for us now to take a step back and ensure that we distribute this vaccine to those who need it, to those who are most vulnerable, and those who are going to benefit most. But again, Maria may speak to the issues of how we're trying to get to a better number in terms of those who are susceptible, and Bruce will want to comment on the issues of vaccine distribution.
Thanks, Mike. So yes, indeed, I think the forest fire analogy is a really good one. And if you've heard us speak before many times about the idea when you think of transmission as cases, sporadic cases, and those sporadic cases could be embers. These could be little tiny sparks that could potentially turn into small fires, which are clusters of cases, which in those clusters of cases could turn into wildfires, which are community transmission. And all of the measures that we have outlined through this comprehensive all of government, all of society approach is working towards making sure that those embers, those sporadic cases, do not become little fires or clusters. and that those litter fires of clusters do not become community transmission and those wildfires. And that is what countries are showing us that they can do. And so that fire analogy, I think, works really, really well because we have tools in our toolkit that put out those fires. Those tools that we have break those chains of transmission and prevent the sporadic cases from becoming clusters and those clusters from becoming community transmission. And those same tools help us move from community transmission to clusters and from clusters to sporadic cases. And we've seen that in many, many countries across the world, in all regions of the world, in different types of societies, high income, low income, urban, rural, over and over again, and that will be done again. And vaccines and vaccinations will be one more powerful tool to help us put out those fires. But with regards to the serology, indeed, there are hundreds of studies that have been done that have looked at specific populations. And amongst those populations, how many of those individuals have had evidence of infection? And so they look at a point in time, and most of those studies have been done up through the spring and into the summer in the Northern Hemisphere, so April, May, June, July, August, and they have given us almost a point estimate. In that population, between 3, 5, maybe 10% of that population has evidence of infection. What we are working towards through our Unity studies, and this is a program that we have begun in January, where we, with our partners, have developed protocols, research templates, which we have shared now with more than 100 countries. We are working with them to adapt these research protocols for the countries themselves. We're providing technical support, operational support. We're even providing the serologic assays that they can use to follow populations over time so that we can get estimates of the populations that have this evidence of infection. And our goal in doing so, using a standardized approach, is to be able to pool that data either regionally or globally so that we can come up with estimates to answer the question that you asked in your question to us today. But we're also looking at the immune response over time. So some individuals, and there's some recent studies that have even come out even today or yesterday, that suggest that the immune response may be 6 months or longer. And that's very good news to show that somebody that was infected, even if they had mild disease, develop a robust immune response, and that immune response lasts for 6 months or longer. So that's good. And we're still studying this. So while there are hundreds of studies underway, we don't have all of the answers yet, but the results that come to us, that are shared with us in real time almost, tell us that the majority of the world remains susceptible to infection. And therefore, we have to do everything that we can to prevent as many infections as we can. We will emphasize that every time we have an opportunity to do so, because this matters. Every step that you take that reduces your exposure reduces the opportunity for this virus to infect you, and it reduces the opportunity for you to pass it on to someone else who may be of a vulnerable group, maybe of an older group, that would develop severe disease, need hospitalization, and potentially die. And while we have gotten better at treatment, there still are a large number of people who are dying from this virus. And so it's up to us. So as the DG said today, the virus can stop with us. We need to do what we can to make sure that we break those chains of transmission. Let the virus, first of all, let you not get infected, but if you are infected, let the virus stop with you.